Hey, I'm Curt Ackerman, Vice President of Strategic Development here at Tandem Health. We pray everybody is staying safe out there. Just wanted to start pushing out some communication to the community during these very uncharted times about some of the things that we're doing here at Tandem Health to ensure the safety of not only our patients but our staff as well. And then just really to encourage everybody during these really just weird times. Encourage and hopefully provide some continued direction on how to protect yourself and your family from the spread of this virus. What most people are seeing at different facilities here in town is what they'll observe when they show up to any of our Tandem Health facilities. They're going to get screened at the door. We're going to check temperatures. We're going to ask the big three questions. Do you have cough? Do you have fever? Do you have shortness of breath? Anybody who presents with those one or any combination of those symptoms will be directed to for further testing, further treatment, and there's different avenues that are being delivered and or created out in the community. That comes in the form of telephonic visits, that comes in the form of remote virtual visits, which we're also offering here at Tandem Health. And so there's many different ways that people can have their symptoms and their illness addressed and treated currently. But what we really want to do is get ahead of that curve. How do we prevent somebody from contracting the virus in the first place? And so there's things that we're doing here for our staff as well. So not only are we screening patients at the door, but we're also screening our staff before they come in, checking their fevers, again, asking those three big questions. Certainly stressing standard and universal precautions, gloves, gowns, masks, everything that we need to have in place to ensure their safety. The safer they are, the safer our patients are. Anytime one of our staff members feels ill, even if it's not one of those symptoms, we are paying a lot of attention to that. We're actually asking them to stay home and seek out appropriate treatment for that. So really, a lot of the things that we're doing in light of this very uneasy time and with regards to a virus that really just kind of packs a different punch for us and has kind of caused a lot of concern. The methods to prevent its spread and keep ourselves safe they're actually very basic, and these are the things that we want to, as an organization, continue to encourage people to do. If you have a fever, if you feel ill in any way, just stay home. When you do go out, wear a mask. We are pretty deep into that recommendation now. It used to be like if you go into certain places, if you go out now, just wear a mask. I think it's smart. And that's certainly the recommendation that our medical leadership is pushing out here as well. Covering your mouth, covering your nose when you sneeze, when you cough, these sorts of things. Washing your hands constantly. Hey, gang, wash your hands 20 seconds. Soap and water. If that's not available, then use an alcohol-based hand sanitizer. Again, it's a big bad virus, but the ways to prevent the spread of this, again, are very, very simple. And lastly, yes, the social distancing. We have to do it. It's uncomfortable. There's brighter days ahead. The light is getting brighter at the end of the tunnel. So we want to encourage you all to do these very simple things to help us get back to some sense of normalcy. And if we can be of any help to you, come and see us at Tandem.